In this video training, I will be showing how to document an evaluation visit. Okay, so when we click on that, it takes us to the visit form. Again, you do have the name of the home health company, phone number of the patient, address of the patient. Very, very important if you are having difficulty scheduling this particular patient, all you need to do is click this right here. It says patient having scheduling issues, and it will send an email to All Care Rehab as well as the home health agency. For urgent issues, we do ask you to give us a call. This right here tells you the end of episode. So in home health, it's a 60-day episode, and this date will help you so you do not write a frequency past the episode end date. Physician order. Once you're doing if you've done an evaluation, it automatically creates a physician order for your frequency. But if you're in the middle of the episode and that's something you want to add an ultrasound after 2 visits, or if you want to add treatment put on hold due to family's request. So this is where you go and you click on the physician order, and you can click on, this is where you write. So you can write a communication note from here also. And this is physician's order, medical reason, save physician's order, and that's it. Very simple. I'm going to go back to my calendar right here, go to visit form. So this is your first tab once we are in the visit. So let's say this particular patient, these were the vitals. You save the information, you click save. Very important under any tab, it's important that before leaving the tab, you save this visit information tab. If otherwise, it's not going to save it. If you keep moving on and something happens, all your information is not going to be saved. Second tab is your diagnosis. You can choose what diagnosis, depending on what the diagnosis is. Prior level of function, if the patient was prior to the surgery, was the patient able to walk a block, 10 steps with a walker, with a cane. So we definitely like to get all that information right here. Medical history, please do mention the age and the gender of the patient. If the patient is malnutrition, patient is obese, patient has sedentary habits, patient has what are the comorbidities. So it's very important to put all of those things in the medical history. Precautions, like if the patient is a fall risk of contractures, the patient has cognitive deficits, so all those can be recorded in this. And then we click on the Save Information tab. The next tab is skilled observation. Please do justify the homebound status of the patient. Every therapist has to do that on each visit. If you see the patient is independent with driving around, patient is going out for recreational activities, please let the home health company know, or please inform us as soon as possible. Pain assessment. Again, depending, what it is, pain controlled with medication. In this tab, pain is considered a 5th vital, and when we have audits, it's extremely important that this is well documented. So with pain assessment, what you need to ask is not that if you have any pain, we'd like to ask, are you taking any pain medications? Sometimes you will find when we ask, do you have any pain, patient's response will be no. But when you go through the medication list, you see, oh, patient is on gabapentin, hydrocodone, Percocet, and then it's like, oh, are you taking these medications? It's like, yes, but I don't have pain. So it's very, very important we choose the right response. Is the patient pain controlled with medication, or patient does not have pain? This is very self-explanatory, oriented, receptive, motivated. This is your strength, upper extremity strength, lower extremity strength. If this is gross testing, but you can always write detailed hip flexors, hip abductors, knee extensors over here. Your sitting balance. In this, it's very, very important you are documenting standardized testing for balance. if patient is a fall risk. So let's say you chose to go with TINETI test and then you do the TINETI during your evaluation and your reevaluation and discharge. That way you have a standardized test to either justify continuation of care, or patient is not responding to care, or patient has met their goals, and that way those scores, those standardized testing will help you justify whatever you're requesting. You click on Save, Visit Information, same, and then Functional Mobility. Under Functional Mobility, it's important to identify if the patient is independent, supervision, what is the level of function. So this is something that as a professional you need to judge. Is the patient safe to stand up from the chair by herself or himself? Patient is telling you, oh, I do this. Yes, I can take a shower, I do it. But as a therapist, we'd like you to identify, is the patient safe to do that? So when you're choosing the level of function, please keep that in mind. And then that is the true level of function. For residents of assisted living facilities or board and cares, your automatic, if they are able to do sit to stand or transfers or rolling in the bed or bed mobility, it's under supervision. It's not under independent. The very reason they are in assisted living brings them under supervision category. So please keep that in mind. These are, again, all the different tabs, very easy. You can choose, let's say the patient ambulates with a walker, 100 feet, or we can say, let's say 90. Please do document the pattern of the gait, all the details. What is the posture of the patient? Is the heel to toe component of the gait pattern missing? If there is hyper hip flexion, if it's a circumductory gait, different. So basically, it's the details. When you just document patient uses a walker and walks 90 feet, we cannot identify, if you have data for 10 different patients who walk with a walker and walk 90 feet, you cannot tell one from the other. So it's extremely important that we're documenting the gait pattern. Does the patient has cardiac issues? Does the patient get short of breath? Is a COPD patient? Patient starts getting unsteady after 40 feet of ambulation, dizziness. So all those things, if you're documenting it, it helps us to justify continuation of care. The next tab would be Home Assessment tab. In this section, the therapist evaluates the patient's bathroom basically area. Is the patient safely able to stand up from the toilet seat? Does the patient require a toilet raise? Are there steps? Is there clutter in the house? Is the patient able to go in and out of the shower? What kind of shower is it? Is it a bathtub? Is it a walk-in shower? So all those questions you'll be addressing in this section, and also you can write your recommendations. Physical therapist recommending a grab bar right next to the toilet, a physical therapist recommending a grab bar next to the bathtub. And in addition to that, please do document the patient's response. Sometimes we will see the therapist says, oh, Ms. Smith, you need to remove the rug. This is a loose rug. And Ms. Smith does not want to part with her rug or does not want to apply a tape. That's her favorite rug. So please do document the patient's response also. Under interventions and teaching, I learned in one of the conferences, a great thing is we can do a video recording. When you're doing some of the exercises, or when you're teaching some of the exercises to your patient, you can ask for a video, a phone, and say, may I use your phone and make a video? And if they say yes, please document that, requested patient permission and patient was okay with that. So, and you can teach the patient home exercise program, make the video, and patient has access to that. So that's like a session, that's like a live session for them with all their therapist instructions. It's a great tool. and very high patient satisfaction we've seen with that. You can definitely, you can check off exactly what you did, therapeutic exercises, balance training, bed mobility, but at the same time, please do document just a little blurb in the text box as to what were the details of your exercises. Just checking off therapeutic exercises is not enough. Under the plan of care and goals, this is where your frequency goes. When you're documenting or writing a frequency, if you evaluate a patient on a Monday, Tuesday, Wednesday, or let me rephrase it. If you document you're evaluating a patient on a Sunday, Monday, and a Tuesday, please do write a frequency, another visit during that week. So let's say if the evaluation was done on Monday, write a frequency, let's say 2 week 4. Let's say if the frequency was done, if the evaluation was done on a Thursday, in that case, we would like you to write a frequency of 1 week 1, 2 week 3, or you can also write 1 week 1, 2 week 3, 1 week 1. That's a total of 8 visits. And the reason for that is on a Thursday, we do not have room. If a PTA is going to be seeing this patient, we do not have room and time to schedule a second visit for this particular patient if your evaluation is being logged by Thursday afternoon. Under special circumstances where you feel, if it's acute knee replacement case and you feel this patient must be seen one more time this week, please pick up the phone and call the account manager at All Care and request, and they will accommodate the patient for second visit during that week. Effective date in this case, let's say, is 27. Point to be noted, if you are doing a re-evaluation, then this effective date is not going to be the same date. It's going to be the next day, or it's going to be the next week, depending when your frequency is going to be effective. Right here, you have to write the body part if it's the right knee, left hip, or both lower extremities. Under plan of care, you have to check exactly what are the things you will be focusing on all the way. These are your goals, very important. You have to put a time frame as to 4 weeks. We do not want to write a frequency past 4 weeks, and the reason for that is there's a 30-day progress note that needs to be written. We try to coincide your re-evaluation and your progress note. So you definitely do not want to go past the 4-week time frame when you're writing your first frequency. These are all the goals you can check off, and you can also write your custom goals over here. Patient to demonstrate ambulation outdoors on the sidewalk with the walker with standby assist for 150 feet. So, or you can say patient to demonstrate safety during curb negotiation. So try to be as specific as with your goals. It helps. So, and you save. Case conference. We quite often see the therapist quit this part. This is mandatory tab. So you can check off all the things that you, when you are evaluating a patient, if the patient has pain or edema, even though you're not addressing those problems, but if the patient has that, you have to write it down over here. You can write, so something that's not in these check boxes, you can definitely add in this text box right here. In the end of visit tab, this particular section, you don't need that on the first visit and evaluation, but you can use this during your re-evaluation and your discharge visit. This is your date of visit, time, so we'll just put 11 a.m. It has to be a 45-minute visit for you to bill it. For physical therapists and occupational therapists, it's very, very important that you are calling the home health agency during an evaluation, re-evaluation, and discharge. We have to report, we have to call them and report. And who you spoke with, we'd like you to document. So it's extremely important that you're documenting the name of the person who you spoke with. Again, let's say we'll put a random name, Tina. Let's save it. And this is your patient signature, patient sign, right here, save. And okay, so your note is complete at this point, and all you have to do is assign and lock, and you're all done. I will be doing some other videos for follow-up and discharge visits as well.